Youth, in this case, young people between the ages of 16 to 21 across the world, are active users of technology and social media. The COVID-19 pandemic and the resultant lockdowns have accentuated young people's engagement with technology and social media. While this has numerous benefits, it also comes with its cons, one of which is cyberbullying. Hence, it becomes extremely important to understand the effects cyberbullying has on the mental health of youth. Our review of literature also highlighted that there was a paucity of research on the impact of cyberbullying on the mental health of Indian youth. Cyberbullying is bullying with the use of digital technologies. It can take place on social media, messaging platforms, gaming platforms, and mobile phones. Our study explored the following research questions. One, how does social media affect the mental health of Indian youth? And two, how do young people cope with the experiences of being bullied on social media? Our study is a mixed method study in which we use both quantitative and qualitative methods of data collection and analysis. We designed a survey questionnaire to collect quantitative data. This was shared with participants between the ages of 16 to 21 in the form of a Google survey. The participants were undergraduate students from different universities across India. We received 106 responses. Through these questions, we tried to gather information about their age, gender, forms of bullying they experience, the medium of cyberbullying, and its effects on their mental health. This helped answer our first research question: how does social media affect the mental health of youth? For the qualitative method, we interviewed 6 participants using semi structured interviews. Semi-structured interview is a qualitative interview method where certain questions in the interview is predetermined, but follow-up questions can be asked based on the participant's response. For the interviews, we use purposive sampling, selecting participants who both consented to being interviewed in the survey questionnaire and have faced cyberbullying. The interviews were conducted to obtain in-depth understanding of their experiences with bullying and how they navigated through their experience. These interviews helped answer our second research question: how do young people cope with the experience of being bullied on digital platforms? Through the survey questionnaire, we found out that the most prominent applications where bullying took place were as shown on the first diagram in the screen. We also found out the top 3 effects it had on the mental health of the survivors, and this is shown in the second diagram on the screen. We conducted 2 hypothesis tests through chi-square test. First, we test the null hypothesis that there is no association between cyberbullying and mental health against the alternative hypothesis that they are associated. Here, our p-value for the test turns out to be less than 0.05, and therefore, at a 5% level of significance, we reject the null hypothesis and conclude that getting bullied has effects on mental health in this specific age group. The second one was to see if there was a role of gender in getting bullied. Since our p-value was more than 0.05 at a 5% level of significance, we failed to reject our null hypothesis. The interviews were transcribed and analyzed using the process of open coding, followed by categorization. Open coding involves identifying words, phrases, and whole sentences in the interview that are relevant to the research questions. These open codes are then categorized, and a category is essentially a collection of related data that are grouped together into a higher order heading. Close analysis of data within a category enables researchers to identify and characterize the category's properties. The following categories emerged across the 6 interviews, and they are presented on the screen. The following were the findings of our mixed method study. 72.6% of the respondents reported being bullied. Instagram, WhatsApp, and YouTube were prominently mentioned as the platforms where bullying took place. Our study participants reported being more affected in cases where the bully was an unknown or an anonymous person. This is because they were not able to confront the bully, and it also left them perplexed as to why they were bullied if they didn't even know each other. In our literature review, we found 2 contradicting views, one which states that the bully being known causes more distress, and one which stated the bully being unknown causes more distress. By using a mixed method study, we were able to understand which caused more distress and why. 3 prominent types of bullying were spreading fake rumors, creating fake accounts, and receiving online threats. Cyberbullying had the following effects on their mental health. It made people anxious, led them to isolate themselves, and lowered their self-esteem. The findings of the research support our hypothesis that bullying affects the mental health of youth. Based on our chi-square testing, we found out that the gender of the victim wasn't a factor due to which they were bullied. We found out that there was no association between the gender and them being bullied. The research findings will further be used to design an illustrated guidebook which will aid the survivors of bullying and the general public by providing information about cyberbullying, its effects, and the ways to overcome it. Thank you for listening to us.